Good day, I'm Jackie Judd. Schools have become an important source of health care for a growing number of children. More children have more complicated needs, and for a small number, the school nurse or doctor is the only regular source of medical care available to them. So how are schools meeting these needs? Ensuring Your Health columnist Michelle Andrews has been looking into that question, and she joins us now. Welcome, Michelle.
Thank you.
Let's talk first about the picture of young kids today and the kind of health care needs that they do bring into school, how it differs from decades ago.
I think that what we see now is that many more children have conditions. Obesity, for example, is a big problem. Diabetes, other chronic conditions, mental health conditions, conditions related to sexual activity. There are about 16% of kids, in fact, that they estimate have some sort of needs like these that need to be met in school or elsewhere.
And so many kids these days, so many more than they used to certainly, bring in prescription medications that they need to take on a daily basis, and only a school nurse can provide that to them. How many schools have nurses on the premises day in and day out?
About half of schools have a nurse on the premises 24/7 every day. Another 25% or so have a nurse there sometimes. But only about a dozen schools states in the country meet the ratio of one nurse for every 750 students, which is what's considered optimal.
And for those schools that have no nurses on the premises, what are the alternatives for the kids?
Well, there may be no alternatives. In some cases, there are school-based health clinics that are more like primary care clinics for these kids. And I should say that sometimes nurses and school-based health clinics operate in one school. That's a lot, but in a minority of schools, they do have these clinics, and these are staffed by doctors, and they may have a social worker, they may have a mental health practitioner, they may actually provide dental services.
So this really becomes a site of primary care for some children.
Indeed.
The healthcare reform law that was enacted last year gets at this issue of the school-based health clinics. In what ways?
Well, the reform law appropriated $200 million so that school-based health clinics could add equipment or renovate or do some construction. Now, about $100 million of that has been or is about to be distributed to some 350 schools that have applied. But then there's another $100 million which will become available next summer, and there's some question about whether that will be actually coming through. There have been efforts to actually cut back on that money.
So the funding in the healthcare reform law was directed at these more sophisticated facilities, the clinics.
Yes.
Is funding for a school nurse problematic in some states?
Certainly in some states it can be, because they're often funded by education departments or state health departments, and those, as we know, budget crunch time, they're all looking for ways to save money. So in some locations you do see that the school nurse is getting cut. In others, though, school nurses are being added. That's not as clear a picture of difficulty or trouble, but certainly in some locations it can be.
Okay, a subject that is of interest to many parents as the school year approaches. Thank you so much, Michelle Andrews of Ensuring Your Health.
Thank you.